2008 Arctic Winter Games and the Vancouver 2010 Winter Olympic Games. Also, Dr. Affleck was the producer and co-writer of the movie Unforgiven, a film about inequalities in health service for Indigenous people living in Canada. Thank you.
I'll just stand up here. I just have a few minutes, and thank you for inviting me. I've never been to a Rotary Club meeting. I tried, but no one would ever invite me. Thank you, Austin, for reaching out. And I see many familiar faces here. And the film is called, sorry, it's The Unforgotten, but you must have forgotten that it was not The Unforgiven. And Leela Gilday did the soundtrack. Karen Blond and Paul worked on it and so forth. We can talk about that later. So I'm an ex-Yellowknifer, although I still come back from service. I see many people I know here, lived here for many, many years. We were drawn out of Yellowknife because of health reasons for my wife and because of professional. She's a professor at the U of A and I'm working all over Canada. So I'm an export from the Northwest Territories. I work as a health informatician in Ottawa, in Alberta, all over, but I cut my teeth here with Marta and other people. We worked together quite closely for many years. So I was just asked to talk a little bit about charting systems, which seems sort of like a boring topic, maybe, but it's not. In 1992, the Supreme Court of Canada decided, there was a case called McInerney versus McCollum, that individual Canadians, all of you, really own your health information. Have you ever tried to get it? Does it follow you where you go? Have you ever tried to navigate your care from the Northwest Territories to Edmonton, which is one reason we had to leave, because my wife needs specialist services? It's a bit of a disaster. Last night I got an email for an inquiry into a case that I was involved in when I was up for a locum recently about a death, because I work as a hospitalist at Stanton. And part of the problem in that case was that information was missing for myself and the 5 other physicians that we were handling the case. It has been my passion for the 30 years I've worked across Canada's north, and I worked in the Eastern Arctic, the Central Arctic, and then in the last 20 years here, to try to drive equity and equality in care for people in remote and rural Canada by delivering care to them. And one way you can do that is through the virtualization of services, by giving them ownership and control of their information. So many of you have been to the clinic and you see people typing away on this chart. So the Northwest Territories has the most integrated charting system in Canada, which is largely unknown to the rest of Canada, and it's been largely ignored. And this is a project that I led, and with people like Marta, and there were many people involved, but it took 17 years to build that. So there's one chart, whether you're in Fort Good Hope or in Delaunay or here, that's the same chart. Your information follows you, but it stops at the border miraculously. And when people have problems there, going across borders or between health services, I like to call this death by governance, and I don't, it's a bad joke, but it is dangerous. So I'm involved, I'm a member of the expert advisory group on the Pan-Canadian Health Data Strategy, which the Council of Deputies is, and we're just coming up with our 3rd report. We have huge issues in Canada with the safety with which we use health information. It doesn't follow people, and it should. I would like to say that health data in Canada, so every decision we make as physicians, nurses, pharmacists, whatever we do, even researchers, health administrators, so forth, we make those decisions based on information. That's the raw material, the fuel that we consume to do our work. If it is missing, inaccessible, lost, inaccurate, the likelihood of us making an error increases. Right? And I can tell you, example after example, when this has happened. Interestingly, in Canada, no one studies that. No one studies the impact on patient outcomes from informational errors. It's missing. There's a lot of legislation around privacy and security of health data. We have to assure that it's private and secure. It's very important. But there is an absence of legislation around the safe design and use of health information. And in Canada, virtually every jurisdiction, including ours, through our Health Information Act here, legislates that your health information is under the care of a custodian. Whether you're at BC, Alberta, Nova Scotia, and NWT, there's Health Information Act, so the custodian manages this. So that this gives power over the use, over the control of health information to custodians, which are health authorities or pharmacists or physicians, health professionals. But what it effectively does is fragment the information between those different services and jurisdictions. And so there's 13 versions also of custodial law. So what we have in Canada is legislation that was created before the digitization of information that very successfully fragments your information and makes it difficult to get it to where you happen to be and where the person taking care of you needs to see this information. So this is my work now, and I work all over Canada doing this because it's unsafe, and frankly, we need to change this. So we need to it's actually a fairly significant amount of work, but we need to change public policy in Canada in a manner that your health information follows you where you are in a manner that is safe and effective for you. This is in Nova Scotia, everywhere. We're all the same. So it's with variations on the theme. So, yeah, and I think I'm almost out of time, but so this is basically what I do, and it's a fascinating work, and it arose out of this experience here building. Then there were 8 health authorities building a single charting system through 8 different health authorities. It became one health authority, and it's fascinating the reluctance of the health sector to understand that in fact we shouldn't design your information around us. We should actually design it around you. What a shock. But that is what has happened. And in fact, the preponderance of privacy legislation can be dangerous. It is very important that all your information is secure and confidential, but not to such a degree that it damages you. Damages your health. There's many ways to harm people. We can breach your information, but we can also harm you physically and mentally. Most Canadians don't know any of this, until they become ill. And I lecture broadly across Canada, most of my Zoom now, but I give probably 20 or 30 keynotes a year on topics such as this. They do not understand this, then they become ill, and then they come and they approach me after and say, I copied all my records because I don't trust the system. And there are instances of excellence here and there scattered around, but in general it is deeply poorly designed. And there is a profound lack of literacy on the necessity to design health information in a safe way for people, for us, for citizens of Canada, on the part of professions, governments, health leadership. So if it's a battle I had here in building this one EMR, was trying to explain to people that actually this is our obligation. It's not just it's inconvenient for me to have to use. When we built this EMR, I was told by public health they wanted their own system. I was told by the specialists they didn't want a GP system. I was told by the GPs they didn't want a nursing system. I was told by the nurses they didn't want a GP system. Everyone's blaming everyone else's system, and it's a patient system. But who cares about patients, right? So that is, anyway, that's I think I'm out of time, but no one ever thought I wasn't opinionated or had passion about things, so there you go. But what's so important is that you guys recognize this, and some of you may have experienced this. I see nods in some places, but this is essential. And the government, here there's great confusion about who's actually driving all of this, whether the health authority, the department, and so forth. We built a new hospital in 2019. It was a $12 million project to put a clinical information system project, and it failed. Some people know all about this. It failed through mismanagement. I don't know where the money went. So it's essential that you guys demand thoughtful and coherent leadership here. And we need to empower citizens, Canadians, to do so. And part of my work in Ottawa is to build citizen councils. I work with all kinds of patient advocacy groups around this. Some of you may be aware of the film Falling Through the Cracks, which is the Greg Price story. There's a gentleman, 32 years old, who died in 2012 from mismanagement. He's the only Canadian who his death has been ascribed the first cause to mismanagement of his information. He was an engineer and a pilot. His father and sister have become close friends of mine, and we advocate across Canada for coherent information system design. But it's growing, and the last thing I will say is COVID has been a benefit, not in many respects, but for dudes like me, because I was like the Maytag repairman saying no one cared about this. Right? But suddenly it legitimized discussions of virtualization of care and discussions about digitization of health and health information. So people are beginning to listen. Canada has performed very badly with data, health data around COVID. So I can only say that you guys need to advocate for this. You need to advocate for yourselves and for all Canadians. This is something that has not been understood. We need to be better certain. We need literacy around health data use in government, among professions. It's universal. I'm not blaming any group. Those of us in the health sector are failing. We have not performed adequately because we're ignorant of the true issues we need to address with respect to health information. So thank you very much. I don't know what I'm supposed to do here, but I got a free meal. Or do I have to pay as well?